The differential diagnosis of monoarticular gout includes septic arthritis, trauma, and cellulitis, as there is often significant swelling and erythema of the surrounding tissues. The patient may also be febrile. The differential of asymmetrical large joint polyarticular gout includes the seronegative arthropathies, which classically include a family of joint disorders that includes ankylosing spondylitis, psoriatic arthritis. It can be the IBD-associated arthritis, reactive arthritis, also termed as Wheater's syndrome, undifferentiated SPA, and osteoarthritis is another disorder which can also manifest as polyarticular condition. So keep in mind all of these differentials when you have a patient with a painful joint and you're suspecting that he or she might be suffering from gout.